the patients come in, you ask them all these questions, and then we're doing like fluorescein dyeing and tear breakup time. So what's that office visit mainly like once they come in and once you do all of that?
So once they come in and we talk about, do you have dry eyes or not? Do we do the testing for it? Do you have it? And let's open up the discussion for that. So there's a lot of different things a lot of people have heard about, whether it's prescription dry eye drops, whether it's artificial tears or heated eye shields or specific dry eye procedures that we do here in office. And we talk about all those options just to see if something kind of piques the patient's interest a lot more. Because a lot of patients with dry eyes have done the Restasis, the Xiidra, the prescription dry eye drops for years, and some of them feel like it works well for them, and some of them feel like it hasn't gotten anywhere for them. But some stuff we'll talk about and that we've done years ago before we started doing what we were doing recently is to open up the conversation about, yes, we'll talk about artificial tears. Yes, we'll talk about heated eye shields. It's kind of where we started from when we started doing dry eye stuff leading into what was the pandemic years, basically. Now for a little over a year now, we've done more of the BlephX and Ilux 2 options, and we've actually done quite a bit of those here. That's been some newer stuff for meibomian gland expression and heating, and I made some videos on YouTube that just kind of describe this to patients. I've got like a huge TV in the exam room with a picture of one of the earlier patients that I've done, and I was like, hey, can I use this as just like demonstration for people so they can kind of understand what these glands are? Because now more recently, since I put this up a few months ago, all of them look at that picture and go, what is that? And is that me? Because they want to know, is something wrong with me? Is there something going on? And who is that me, basically? But it just paints a really good picture to open up the discussion to say, here's what we do. Here's an option for you. You can consider this just something a little bit different. And it kind of helps not have to use the eye drops, not have to use the heated eye shield or anything like that for you for potentially several years, potentially 1 year, potentially 6 months. It just kind of depends on how you respond to it. So really just opening up the conversation to say there are more options than just artificial tears, prescription dry eye drops, and heated eye shield stuff, because we've done all that.